So our presentation is looking at the implications of barefoot and shod running due to barefoot running being on the increase in the running population. The research we found is looking into common injuries associated with both barefoot and shod running, along with the pros and cons of running in runners as opposed to barefoot. So we'll look at the biomechanics of running, impact of runners, impacts of barefoot running, injuries from both runners and barefoot, and then some conclusions.
Okay, so the biomechanics of running. Traditionally, the gait cycle was divided into two different phases, the stance phase and the swing phase, as well as the upper body and the arm mechanics, but as our research is looking more into the feet and the knees and the ankles, that sort of thing, I'm going to focus on the stance phase and the swing phase. So the stance phase, again, can be broken into 4 different phases. The initial contact, braking, mid-stance, and propulsion. So the initial contact, which is also sometimes referred to as the float phase, this is when you're about to touch the ground with your leg extended out in front, followed by the other foot coming off the ground, and in swing phase. The initial landing contact can either be accomplished by landing on the heel, midfoot, or forefoot. Then we have the braking phase. So through the swing phase, your body begins to decelerate and control the landing. The leg used during the initial phase flexes at the knee and ankle, and the foot pronates, and this absorbs the forces during the impact. Mid-stance, this is also known as the single support phase. This is when the initial leg is at maximum flexion directly under the hips, and it's taking the maximum load at that point, and that's when you are most likely at risk of getting injury. Propulsion, this is achieved by full extension of the initial landing leg, pushing the body up and forwards. Once the toes leave the ground, the propulsion phase is complete, and you're then in float phase, and then again you return back to the initial contact phase. Then we've got the swing phase. So this movement is achieved with little conscious effort. So the initial leg has now travelled as far back as it goes, and the heel lifts forward, lifts towards backside, and this is dependent on the speed you're running at the degree of hip flexion. So here I'm going to be looking at how each phase relates with one another, and how their association can determine the quality of running. So some kinetic variables that we know are present during running in order of importance include centre of mass, stride frequency, stride length, range of elbow motion, and internal knee angle at foot strike. So the support time is associated with the balance time, and that's a major determinant of the quality of running. During locomotion, the running technique is adjusted by changes in stride length, and this is influenced by support and balance time. So obviously the decrease in stride frequency may be a result in increased balance, and as we should all know, the shorter the stride, the shorter the arm movement. Cool. So the major muscles involved, so the semitendinosus, that's activated during hip flexion and knee flexion. So it allows to diminish electrical muscular activation during the stride in other muscles, which are the gluteus maximus during the, should say support phase, not balance phase, and the semimembranosus in the balance phase. Then we have the rectus femoris, so during contact phase acts as a powerful hip flexor, leading the centre of mass to be projected forward. However, this action is considered as a backup due to the action of the iliopsoas muscle, mainly due to the knee extension at the end of balance phase.
Alright, I'm going to talk about the benefits of shod running and barefoot running. So I'll start with shod running, which just refers to basically wearing shoes, and in most cases it's runners. So when you're wearing runners, you tend to run with a heel strike pattern, so running heel to toe. And when you're using this action, there's a heavier reliance on your footwear and on the skeletal structures to absorb the force, and decrease the stress on your leg. So the cushioned heel is designed to absorb the force and minimise the stress on your leg. And the coverage of a shoe also provides protection against the environment. So without coverage, individuals have an increased risk of skin abrasions, puncture wounds, and localised infection. So benefits of barefoot running. A study by found that when using barefoot runners, you tend to use a forefoot action, which is landing on the ball and toes of your foot. They found that this reduces the impact when you're making contact with the ground. A separate study by Barefoot and others, they had 35 subjects run 2 bouts, 4 minutes on a treadmill in barefoot and shod running conditions. They found that the barefoot running showed lower contact times with the ground, increased pushing impulses, and an increased pre-activation of the triceps surae muscles, which is just referring to gastrocnemius and soleus muscles. And they also found that the barefoot running reduced the contact with the ground as well. Other reported benefits of barefoot running is in the increased musculature of the foot. So, a study by Brueggemann and Pothouse, they found that barefoot running increased the cross-sectional size and strength of the intrinsic muscles in the foot. And with these findings, they concluded that it elevated the arch of the foot and was able to act as a more effective shock absorber. Another benefit of barefoot running is an increase in proprioception. And proprioception training is important in rehabilitating the ligaments and providing afferent feedback to the joint after injury. So a study by Robbins and others, which was not specific to running, but it was more looking at sports and wearing barefoot shoes. They found that when rehabilitating the ankle as a result of sprains, barefoot conditions resulted in a 58% increase in foot awareness compared to just wearing ankle taping. They stated that the ankle sprains were attributed to reduced proprioception, which could be increased by wearing barefoot footwear, just in general movement and walking around and stuff like that.
I looked at the effect of running with shoes. Across most of the articles I found, there was, as you see, a couple of benefits, but mainly they were downsides. So firstly, the pros. They can reduce the likelihood of osteoarthritis in your knees. So because they absorb some of the shock, there's less wear and tear on your knees over time. So as you grow older, the chance of getting arthritis in your knees is reduced. And also, it can help with knee flexion. So when you're running and you change surfaces, the amount of flexion in your knees changes. And if you're wearing runners, it reduces this amount. So if you're running barefoot, you'll have more knee flexion, but if you're running with shoes on, there'll be less, which once again will lead to less chance of getting osteoarthritis in your knees once you're older. But I found there was more downsides to running with shoes than there are upsides. So it places more reliance on the medial side of your ankle, which is not generally the most common side of injury in runners. So if you're running with runners, you've got more chance of rolling your ankle and injuring the ligaments on your medial side. It has greater impact forces with competitive runners than regular ones. So what that means is the competitive runners are mainly the shod runners, not the commercial ones you just get in the store, but the ones that athletes use in like the Olympics and such. And these lead to great impact forces. So if you're using the commercial runners, it helps with your knees, but if you're looking at higher levels, it kind of does the opposite, and it doesn't help you at all. But if you want the benefits, you need a very specific design that suits you. You can't just go out and buy a pair. You need one that suits your body and helps with that. And yeah, it causes, as I said before, a greater pronation of the ankle and foot. And they found that one of the studies that I looked at found that as a focus on shock absorption, they thought this was the greater chance of injury that occurred in your ankles, but it wasn't. They need to focus on the amount of torque produced while running, which is actually the biggest risk of injury. And if they just continue to focus on shock absorption, it won't actually reduce any injuries in your ankles. And also, one of the last studies I looked at found that if you're using runners, you actually use you need more oxygen to keep running, and compared to barefoot running, which uses less, and average heart rate across the study found was higher for people that use runners compared to barefoot. Yeah.
obviously, I guess when you think of barefoot running, you'd probably consider there to be more injuries, but the studies have shown that there were no specific injuries to barefoot running compared to running with shoes, other than obviously cuts, abrasions, thermal injuries from running on a barefoot surface. So obviously we've got the common running injuries, plantar fasciitis, tibial stress syndrome, Achilles tendonitis or knee tendinopathies, ITB syndrome, metatarsal stress fractures or stress fractures up the leg, which can be also common in normal running with shoes. Calf strains, hamstring strains, all those kind of deals. The Lehman study that Kate talked about also found that there was an increase in activation of ankle plantar flexion in the gastroc during the foot strike, and although they considered it might actually reduce the forces, they also found that it then increased the forces on the surrounding joints and tendons, obviously increasing more strain. The only thing with all research that we did find is they took runners who had originally ran in shoes, no natural runners or people who'd obviously digressed down to barefoot running, and tested them in a barefoot thing, like a scenario. So basically where the main injuries have come from is people who've gone from running in shoes, have caught onto the trend of the barefoot running and the advantages that it holds, and have decreased down to a minimalist shoe and then down to bare feet, and that's when the majority of the injuries have occurred.
Okay, so the potential risks and benefits of barefoot running are evident. However, more sound evidence is required before clinical recommendations can be made. The transition from shod running to barefoot running must be a gradual decrease and structured, otherwise the risk of causing injury rather than preventing it is also increased. So our proposed research question.
So basically we think that you would ideally be able to start someone from a young age, so a young adolescent, not teach them to run or train them to run in shoes, train them to run in a barefoot condition, have a large group of them, and then assess them over time to compare them to a group of trained runners who will be running in shoes, same training program, assess their biomechanics, assess their injuries if there are any injuries. But then I guess you always come back down to the problem. You can't exactly go for a 3K run around the block in bare feet if you lived in the city or anywhere, really. So
yeah.
Rough man to driving kids in shoes.